Well, hello to people coming in. Welcome. Very happy to see you here. We'll go ahead and talk slowly for a moment to let everybody's audio come on and video come on. But I just want to say hello and welcome. This is the Families for Depression Awareness webinar, Connecting with Care, Essential Communication Skills for Mental Health Caregivers. I'm Susan Weinstein, the Executive Director at Families for Depression Awareness, and I've been looking forward to this webinar. I'm glad you could be here. I'm going to be referring to Families for Depression Awareness as FFDA from here on out. So at FFDA, we know that family caregivers, and when I say that, I mean people who provide forms of support to someone who's living with depression or bipolar disorder. We know that family caregivers have a lot on their plates and on their minds, so we design our webinars to provide clear, practical strategies and actionable advice so that caregivers will feel better equipped to provide effective support to others and take care of themselves. And don't forget that last part. In this webinar, we're going to consider 4 scenarios and provide concrete examples of how you might approach a potentially delicate conversation. I'm super pleased that Dr. Chris Segrin agreed to work with us again. In 2021, we joined forces to present the webinar, What If I Say the Wrong Thing? Tips for Communicating When Your Loved One is Depressed. If you'd like to watch it, you can find it in the Adult Depression Webinars playlist on our YouTube channel, which you will find at FFDA1, the number 1. Right now, we are launching a poll. I hope that you will participate. How confident are you about communicating with your loved one about mental health concerns? And you can choose from very confident, confident, somewhat or kind of confident, and not confident. And we'll leave the poll up for just a moment so that you can consider. As you may have heard, the webinar is being recorded. It'll be available immediately after it airs. We'll also send out a link to everyone who's registered, so don't worry if you need to step away. It will be available. And also, we want to make it easy for you to share the webinar with someone who might benefit from it. As we proceed, would you please use the Q&A feature to submit your questions? I want to thank those who submitted questions when they registered. Very thought-provoking. We've already planned to answer those either through the webinar presentation or following, so you don't need to resubmit them. During the webinar, FFDA staff will be dropping links and information in the chat, so keep an eye on that. We also invite you to participate in the chat, and thank you to everybody who is already doing what I was going to ask you to do, which is, you could start with a hello and your location. I'm Susan from outside of Boston. And just a word, I'm sure you know this, but I feel like I need to just say it. We welcome your participation, but please don't share personal health or medical information or anything that should be private. If you have to think about whether you should put it up or not, please don't put it up, because that's just going to be there for a long time. All right. Let us end this poll. And looks like most people are kind of in the middle. We don't have super high confidence and we don't have super not confidence. So that's good. It gives everybody room to grow. All right. And I'm going to see if I can get that out of my way, but apparently I can't. Okay. So let us go to the agenda. So we're going to start with some brief comments by me about FFDA and introduce Dr. Segrin. Then we'll get right into the scenarios, discussing treatment options, de-escalating during emotional crisis, addressing self-medicating and providing support through trauma. Then we'll jump into the Q&A. And as we close, we'll direct you to our survey. Please know that we do read these. We use your feedback to improve our programs. And if enough people ask for something, then we're probably going to develop a program that you need, because we can make the case to our funders that this was really highly requested. So please do spend a few minutes letting us know your thoughts, and we'll send a $15 Amazon gift card to a lucky person who completes the survey. Our mission, as you can see, is to help families recognize and cope with depression and bipolar disorder, to get people well and prevent suicides. We believe that depression and bipolar disorder affect the whole family. We're talking about something other than the increased likelihood that a child will develop a mood disorder if one of their parents lives with mood disorder. And when I say mood disorder, I'm talking about all of the forms of depression and bipolar disorder. But our philosophy is that when a person is living with depression or bipolar disorder, it's the people around them, like their parents, their adult children, siblings, grandparents, friends, all those people in their lives who have a strong and powerful position to support that person, but they don't always know what to do, and that's where we come in. Families for Depression Awareness provides education, training, and support specifically geared toward family caregivers. We want you all to be equipped to be partners in care who can advocate for your loved ones and help preserve your family unit. People living with depression or bipolar disorder have improved treatment outcomes when they have meaningful family support. You've probably already done this, but I'll urge you to visit our website where you can learn, familyware.org, where you can learn from our interviews with mental health professionals, be motivated by our tools and tests, get educated by our webinars and articles, and be inspired by the people who have generously shared their stories, providing lessons learned, and reducing the feeling of being alone when caregiving. This is one of the features of Families for Depression Awareness, that ever since the beginning, we have been about storytelling and trying to give people opportunities to see themselves in people who have already experienced similar situations. So please visit our website or scan the QR code on this slide to sign up for our newsletter. And now it is my great pleasure to welcome back Dr. Chris Segrin, who is our expert presenter for this webinar. Dr. Segrin is a behavioral scientist whose specialty is interpersonal relationships and mental health. He is a professor in the University of Arizona Department of Communication and is an adjunct professor of psychology and family studies. He teaches classes in interpersonal communication, nonverbal communication, persuasion, marriage and family, and research methods. His research focuses on social skills, relationship development and satisfaction, and such problems as depression, anxiety, loneliness, and marital distress. Recently, he's been conducting research studies on the intergenerational transmission of divorce, how social skills deficits make people vulnerable to depression, and why lonely people have more health problems. You can find his research in several scholarly journals of communication and relationships and psychology. He has published 2 books, Interpersonal Processes in Psychological Problems, which was in 2001, and his 2005 book of Family Communication. He has received multiple teaching awards at the universities of Wisconsin and Kansas and Arizona, and he earned his doctorate degree at the University of Wisconsin. So welcome. As we continue, I'll read through each scenario, and Dr. Segrin will provide comments and insights. We'll also have a poll for each of the scenarios, so please participate. You may find more than one answer to be applicable, but just choose one. And for some of them, we have the sort of something else option, and we'll just ask you to type it in the chat. All right, you ready?
Yes. Thank you, everybody, for joining us. We'll get started.
All right, as if we haven't already been started, but okay. Okay, we're going to turn to the first scenario, which is about discussing treatment options with a person who is experiencing depression. The poll question is, what is the most challenging aspect of discussing treatment with someone hesitant to start it? The choices are overcoming the "I can handle it myself" mindset, finding the right time for the conversation, knowing when to back off, providing a sense of hope, and the option of something else if you want to share it in the comments. While you all are doing that, I will read the scenario and then we'll see where the poll has left us. So the scenario is this: your brother has been experiencing symptoms of depression for several months. He's mentioned feeling hopeless and having trouble sleeping. When you suggest talking to a therapist, he dismisses the idea, saying, "Therapy does not work," and "I can handle this on my own." You want to encourage him to seek professional help, but you don't want to be pushy or dismissive of his concerns. before we start talking about that, we'll close the poll and um, very interesting. Dr. Segrin, do you want to comment? Can you see the results?
Yes, this is not surprising because it is very common for people to resist intervention with the belief, the mindset that seeking help is somehow a sign of weakness. And I need to demonstrate to you and probably even to myself that I can handle this on my own. That's kind of a form of individualism, which is very common in our society. So I'm actually not surprised to see that as the number one answer.
Okay. All right. Well, we'll let you keep talking. Um, how would you tackle this scenario?
This scenario has to be approached with a little bit of knowledge of who the particular person is and what their sort of barriers and obstacles are. Here, they've shared with us a kind of a disbelief in therapy, and then this sort of I'll take it on my own kind of approach. And sometimes a way to move people from this kind of these blockages, if you will, would be like the therapy doesn't work thing, might be to counter that, not to get argumentative, but maybe to cite some personal examples that you know of other people in your life, or even the person who you're talking to, their life, of someone who went to therapy and found something very worthwhile. The the motivation to get out of pain is a very powerful one. And then when somebody is in some state of misery with symptoms, talking to them and reminding them about how bothersome these symptoms have been for them might be an entree to this conversation. You know, we should. This is not to say we're trying to use their symptoms as a fulcrum or a lever against them, but just to remind them, you seemed really kind of unhappy the other day, or right now you just seem like you're suffering so much. Wouldn't it be nice to try to get away from this? And this is helping them visualize a way out of this. And again, providing perhaps anecdotes of people who went to therapy and found it very beneficial. These are what we call the therapy success stories, where somebody maybe was suffering, they went and they got help, and my goodness, they're pretty happy and doing well today. And it helps to counter that it doesn't work kind of mentality. The other thing, and this is a big one, I like the fact, by the way, just as incidentally, there's two men in this slide because this is probably more of a male thing than a female thing, but it's a everybody thing, to be honest with you. The narrative that seeking help is a sign of weakness, that if I go seek therapy, that shows that I'm weak. And the point is that all people need help at some point in their lives. And we should just remember that, remind people of that from time to time. Did you take your car in to get the tires changed? Oh yeah, you needed help with that, didn't you? Right? Is that a sign of weakness? No, of course not. You went out to dinner, you had someone make a meal for you. Is that a sign of weakness? No. You wanted a break from cooking for tonight. So sometimes it helps to just talk people through all the things that we all do on a daily basis that involve getting some kind of help from another person. I go to the dentist, I go to the doctor, I go to the oil change shop for the car. There's nothing wrong with that. Actually, seeking help is not just is it not a sign of weakness, it's a sign of strength, because it says I'm solid enough with who I am that I'm not threatened by the need to go in and seek help, right? So again, using the automobile example, I want everybody listening to this webinar to know I do know how to change the oil in my car. But I go in very often for an oil change, partly because of time, because of convenience, because of the difficulty in disposing of used motor oil, which is really a thing these days. That doesn't mean I'm dumb or I'm weak or I'm unable or I'm a terrible mechanic. And by the way, even if I am, that's not necessarily a shame. But the point is, there's things we do to seek help that are not a sign of weakness. And I'm solid enough with my understanding of who I am as a mechanic that I'm not threatened by having to go into the Jiffy Lube, let's say, and get an oil change. And this is really the same thing. To me, I can think of therapy as sort of a psychological tune-up. And that's not a sign of weakness. That's saying, I want to make my engine as good and powerful and perform as well as possible. So it's a good thing, not a bad thing. And we need to remind people that. Now, when we see people suffering, the immediate reaction is, let's get going right away and fix that. And this is a mistake. We have to be willing to honor their timeline, not try to push people or coerce them. It's when the time is right. We try to set the stage for making them feel comfortable to do this when they feel the time is right and remind them of that. I'm not trying to tell you to do something tomorrow necessarily, but think about it when the time is right. A lot of times, what we do is we share an idea with somebody and then just let it percolate for a while. There's a lot of scientific research on what's called the mere thought effect. Whereas if you just give people time to think about something and let it brew, a lot of times they will come to the right conclusion and do that, but it may not happen immediately. And remember, it's about them, not us. So keep the door open, remind them you're always happy to talk, and you'll be there while they're thinking it over.
Um, it's very interesting to me that a lot of the questions that we've gotten are about how hard do I push when? And
Right.
I appreciate that this slide addresses some of that, but someone just put in when they say medications haven't helped in the past, how hard do you push? Or perhaps how do you approach uh, the conversation for them to try again?
Think of all the things that we do in life where we try and it doesn't work, and we try again and it doesn't work, and we try again. No one throws in the towel after one or two times. Think about marriage. Some people might, date 7 or 8 people before they find one that they want to get married to. Sometimes they date 7 or 8 and they still don't find one they want to marry. We don't throw in the towel and say, well, I'm giving up then. And medication in particular for affective disorders tends to work this way. They work for some people and not everybody. And sometimes it is a process of trial and error. And the successful person is the one who's persistent and hangs in there and tries the other thing. And you know what? That is a message of hope, not of negativity. Hey, that medication didn't work for you. Well, I got good news for you. There's 15 other ones out there on the market, and a good psychiatrist can, prescribe them for you. Just give it a try and kind of do so with an open mind, realizing that the first, the second, sometimes the third may not work out really well for you. But eventually there's reason to believe. And I mean, and I'm not just saying this, there's good reason to believe you'll find one that will work for you.
Awesome. Um, I wanted to say something and I've forgotten what it was. So there you go. You guys may know that issues with memory is a consequence of depression.
Yes.
Uh, all right, so that's all good. We're going to move to scenario two about reducing the temperature of the conversation when emotions are running high. Let's launch the poll. What's your typical first response when someone is emotionally escalated? I had a definite other answer on this one. Try to calm them down immediately, ask questions and listen, walk away or give them space, offer solutions or something else, which in my case would be non-productive. Do what I say, not what I do. Okay, while you all are doing that, I'm going to go ahead and read the scenario. De-escalating during an emotional crisis. All right, your partner is having an intense emotional response during a discussion about their depression. Picture that. They're raising their voice, they're pacing, and making statements like, nobody understands, and everything is pointless. I'm sure that rings true for a lot of people on this webinar. Their agitation is increasing, and you can see they're becoming overwhelmed. You want to help them calm down, but you don't want to dismiss their feelings or diminish their feelings or their experience. All right, we're going to end the poll. And wow, people are good. Go ahead, Dr. Segrin.
That's fantastic. This is obviously a very savvy audience because the open mind and open ears method is a wonderful one for trying to bring the temperature down, calm people down a little bit. Let them have the floor, let them express themselves, and just try to listen and understand. Try to soak it up, just become a human sponge. Tell me what you're saying and let me hear you first. And then as that goes and starts to unfold, you can then begin to introduce your own thoughts and generate a true dialogue. But start by being the bone dry sponge thrown into the bucket of water that's just going to soak it up and listen.
Before you go on, uh, Karen offered in the chat, offer to breathe with them and then be curious with them. I see you're upset. I hear you're upset. I want to help. And, a lot of people react to that kind of physical, I mean, our bodies naturally respond when we do deep breathing. But to have somebody frame it for someone who's upset, I think that that can be very helpful. And for people who aren't seeing it, it was 52% replied, ask questions and listen. And then the next one is walk away or give them space. There are productive ways to walk away and less productive ways. Okay, that's that. Over to you about de-escalation.
Expressing, so the theme here is, of course, approaching this with caution. When people are emotional, things can go sideways very quickly. So this is a time for you as the listener to be cautious. Things like saying statements like, I hear you. I can see you're really upset right now. You're acknowledging and you're validating what they're thinking. This is not the time to argue with them. No matter how crazy the talk is, don't argue at this point in time when someone's emotional. It's like trying to argue with someone who's intoxicated. It just doesn't make sense. Ask if they would be willing to talk further or if they want to take a break. Give them the option that empowers people. Say, look, if you'd like to take a 10-minute break or an hour break, or even come back and pick this up tomorrow, I'll be happy to do that. But let them feel like they're in charge at the moment. That helps to dissolve that nobody understands me narrative. Like, I'm trying to let you run this conversation. If and make them feel comfortable that if you want to take a break, I'll still be here for you. You can count on me. I'm not going anywhere. If that's what you want to just, so if that also gives them the feeling of control, that you're not going to just abandon them during this difficult time. Because sometimes certain people really do benefit from some deep breathing, a step outside for some fresh air, finish their dinner, and then we can talk about it, that kind of thing. So give them those options and let them feel that you'll do what they want to do. And that's very helpful a lot of times.
Before we go to the next one, could you make a comment about validating someone versus agreeing with them?
Right, right. So the statement, I can see you're really upset right now, or I can see why that would be upsetting. That's validating someone, saying you're not defective because you are feeling this way. Now, that's different than me saying, I completely agree with you. You're right about that. In other words, I'm saying that I know when I'm emotional, sometimes it feels like I have the weight of the world on my shoulders. I understand that. Do I really have the weight of the world on my shoulders? Probably not. But there are moments when that happens, and I can appreciate why you feel that way at this particular point in time. So you're not necessarily giving full endorsement or agreement with what they're saying, but rather saying, I can understand why you are seeing things that way at this point in time. And there's nothing wrong, about feeling that way.
Thank you.
This is a theme, and I saw in some of the comments that are popping up, and I can tell many people are in tune with this. This is a time to put the greater focus on listening than talking. So when you're trying to de-escalate, you want to ask questions. Again, this concept that Susan just asked about validating their feelings. Try to help them feel that it's perfectly understandable, maybe even normal to feel that way from time to time. And let them know, this third bullet point is a real important one. I want to try to understand. I'm not you. I'm not inside your mind, but I want to understand how and why you feel this way. So, hear me out. Let me ask you a question. Tell me what you can, because I'm trying to be here for you. Very important. And then normalizing. This is the idea. When we normalize, again, we're trying to shatter that narrative. There's something truly wrong with me for feeling this way. It's like, no, lots of people feel this way from time to time. Uh, and that's true. I mean, all human beings have their bad days, where they feel like this is pointless. Why am I doing this? Uh, and let them know that's not out of the ordinary. And some very strong, happy, healthy people have felt this way from time to time. But this feeling will often change. Again, sprinkle it with a little hope.
Janaya in the comments gave the adage, listen to hear, not respond. And it's something that people need to repeat to themselves until they get used to doing it.
Absolutely. Absolutely right. Now, I want to talk with you a little bit about the concept of emotional contagion. We have to be very careful when we're with people who are emotional to keep our own emotions in check. Emotional contagion is contagious emotion. When someone's happy, it makes us happy, but I got bad news. When someone's anxious, it makes us anxious. When they feel depressed, it makes us feel depressed a lot of times. So we have to be very mindful of not getting vacuum cleanered into this negative affective state. And that means emotional fitness on your part and emotional awareness of when your affect is getting a little bit to the boiling point and maybe you need to take a break. And that's okay. It's okay to say, you know what? Give me five, let me take 5 right now and go out and get a deep breath, walk around, and I'll be right back. You don't want to get pulled too deep into that. And the big mistake some people make is they use other people's emotional intensity as sort of an indicator of urgency. You're crying, so I need to say something right away. That's a classic one, right? No, you don't. Let them cry for a moment. Let them just be with their affect and let them know that you are there for when their emotion settles down and they're able to talk again. You'll talk. Silence is truly golden sometimes. But the good listener who's really able to help keeps their emotions in check. This is a time to think more like a 911 dispatcher than it is, a spouse, a parent, or someone who's really close who gets really caught up in the emotions. And don't be afraid to take your own break if need be.
Wow, Stacy just put in the comments, this is important. My loved one wants my distress to match theirs in order to feel validated.
This is common, right? This is how human beings are sort of wired. That we, if I come home and say to you, "I won the lottery," and I'm excited, I expect you to be every bit as excited. But in the case of, and that's great, but in the case of negative affect, I'm depressed, I'm anxious, this kind of thing. I'm manic. It's not healthy for us to get on board with that. And I think if we keep the focus on, I want to understand you and I want to help you if I can, so it's not about me sharing your emotion. And I don't need to necessarily share it to be able to understand it, especially if you're willing to talk to me and tell me what you're feeling and why you're feeling this way.
Thank you.
Okay, so some warning signs when someone's really emotional and they're really have the thermostat maxed out. When they talk about being a burden to others or wanting to die, hopelessness and worthlessness. I'm no good. Usually, especially with a kind of permanent tone, I'll never be any fill in the blank. People who take dangerous risks like driving too fast, heavy use of drug and alcohol to a high extent, any kind of preoccupation with death. Um, this roller coaster shift from suddenly being very, very gloomy and melancholic and down and out to suddenly happy without any kind of clarity, which could indicate a plan. That is something to really watch out for. Unusual visits or calling people to say goodbye, giving away possessions. These are all warning signs of potential self harm. And we ought to be just keep these in the back of your mind when you're listening to someone who's really distressed. These will lead you to an effective decision about when to seek, like almost emergency intervention beyond just having a conversation with somebody in the kitchen. So those, and you'll often see those when someone's really, planning on self harm. These statements should be taken seriously. We always remember, if you take it seriously and it turns out not to be the case, What happens? Not a whole lot. If you don't take it seriously, and it turns out that this is what their plan is, we'll have the rest of our lives to regret that decision. So I say error on the side of caution. Take all these kind of statements seriously. When someone is talking this way, it's best not to leave them alone. This is a time where you probably don't want to take a break or give them a break. Try to hang on with them. There is the national hotline, you can call it 988, or a hospital or ER department could be helpful as well for someone in that state. If intense emotional experiences are becoming frequent and severe to the point that it's it it's dominating, your interpersonal communication landscape with this person, that also may be an indicator of a different treatment approach. If they're in treatment, of trying something different, or if they are not in treatment, trying to get into treatment. When people just get in these ruts and of negative affect and just cannot get out of it, that might be a time to either switch treatment modalities or start treatment if you haven't already tried.
Uh, Very helpful and very important. And I do hope that people are aware of 988. It's 24/7, different languages, uh, and you can call or text or chat online at 988lifeline.org. Um, as as someone who is concerned about somebody else. It doesn't have to be a person who is in an emotional crisis. They don't have to be the one having the conversation. You can get advice and support as well. All right. Uh, Before we were talking about the suicidal kinds of issues, I was thinking um, that you really have to take the time to mentally prepare yourself for some of these conversations. And I think that that's going to be a theme all the way through.
If I may just quickly address a comment Mary raised, which is a very important one. There's a continuum between self-harm and suicide. And sometimes self-harm can bleed into suicide. That's why all of these acts have to be taken seriously. But yes, most of these warning signs are especially known in the research literature with suicidality. So I just want to make that clarification.
Yeah, there's definitely what we refer to as non-suicidal self-injury, and signs for that are different. Um,
Yes,
but that doesn't mean that you don't take them seriously.
certainly.
All right, next scenario about self-medicating behaviors. What do we have? A poll. How comfortable are you discussing self-medication with loved ones? Ha. I know it depends on the person, but think of who your person is. And while you're doing that, I'll go ahead and let you know what the scenario is. You've noticed your mother has been drinking more frequently to help with sleep and take the edge off. She's admitted to feeling depressed, but she insists that alcohol helps her cope better than her prescribed medications would. Sorry, any prescribed medications. You're concerned about this pattern, but unsure how to approach the subject without causing her to become defensive. Uh, I think the poll is pretty much finished. Uh, People are surprisingly comfortable, with a few being very comfortable and some being somewhat comfortable. I mean, I know it depends on the person, it depends on the time, it depends, all of that stuff and where they are in their depression experience and, whatever else is going on in their lives. So the fact that so many people have a level of comfort is encouraging.
Well, this is a challenging one because here again, the concern with being judged is always in the background, and that's a powerful one. So take a non-judgmental stance. The focus should be on the behavior, not the person. So the idea is heavy drinking can become a problem, and it is a problem for some people, but that doesn't mean the person is the problem. It's the drinking. So remember, there's nothing, I'm not trying to say there's something wrong with you as much as this this medication that you're sort of self-medication regime, and where that may lead you into bad places. It's also good to surround this with, I'm coming from a place of concern, how this might help affect your health. There are, in cases of drinking, for example, there's plenty of information many of us are aware of on the health risks of heavy drinking or other substance use, and how it can often start out slow and then, or at a low level, and develop to a much higher level where you're looking at long-term or serious damage. So again, it's not about judging, not about saying you're a bad person. It's about the behavior being problematic, and then also letting them know, I'm coming from a place of concern for your welfare. I want to see you be happy and healthy. Empathy is very important. Letting people know, I'm not trying to deprive you of what is bringing relief to you. So it's a statement like, it makes sense that it feels like alcohol helps you feel better quickly. We all want relief when we're struggling. I understand that. That's going back to that validation again and helping them to feel like you're not judging them. It is good to maybe mention to people that, that which sometimes brings temporary relief in the short run often brings bigger problems in the long run. There's a lot of things in life that work this way, and probably drinking or taking other substances to control our mood, to manage our mood, is really a great hallmark example of that. Alcohol, for the example, is a depressant. So for someone who's suffering from depression to turn to alcohol to feel better, again, it may be a short-term benefit to that person, but over the long run, it actually can be counterproductive. And again, I'm talking about alcohol here. I'm not talking about you as a person. I'm not saying there's anything wrong with you as a person. I am saying there's something wrong with alcohol as an agent for managing mood. And I don't think it may work for you as well as you'd like in the long run, and can be associated with other problems. So if we're lucky enough that we get that off the table, okay, I'll stop doing that or I'll cut back. What are the alternatives then? So we talked before about, if there are medications that are being taken and they feel like they're not working, asking the prescriber to explore other medications. It would be remiss if I didn't point out here that if they are on medication and they're also self-medicating with alcohol, that's generally not the best idea anyway. There's counseling, there's other forms of therapy. They might be an individual, group, family, marital partner type contexts. Lots of options here to look at. They might be over the phone, over the internet, face to face, all kinds of things. So brainstorm. What are some other ways of dealing with emotions? What are some other activities that make you feel happy, that you enjoy doing? Hobbies, socializing with people, and whatnot. Try to add in joint activities that the two of you could engage in to distract from difficult feelings. They could be things as easy and simple as going for a walk, or watching a movie together, maybe going out to eat. If you have a hobby like a golf or bowling or a sporting event you'd like to go to, consider spending time with them. Okay,
Sorry, I was just twitchy.
no worries.
I did want to call attention to a couple of things in the chat. A lot of people don't know that there are alternatives to emergency departments in many communities, particularly, larger communities. Michelle says if your area has empath units, which can be referred to as psychiatric ER, they can be really nice, a better environment, and can often prevent an admission to the hospital. And it's been helpful to her clients. And in terms of the substance use, um, Michelle writes also that Al-Anon can be super helpful for family members. And that's the family corollary to AA for people who have the addiction. Okay. Y'all are good in this chat. I'm enjoying it. All right. Scenario 4. The self-medicating thing is such a problem for so many families that remembering to focus on the behavior and to move towards alternatives, I think is going to be really helpful for people. All right, the last scenario is going to be when trauma is involved. And the poll question, which you guys have already read, but I'll say it anyway. What's your biggest challenge when supporting someone with trauma or PTSD, post-traumatic stress disorder? And the options are knowing what to say, respecting their timeline, building hope without minimizing uh, the significance, managing your own emotional reactions, or something else. And I will go ahead and read the scenario. Man, we're chugging along. Um, your spouse experienced a traumatic event and has been showing signs of both PTSD and depression. They've been having flashbacks and avoiding places that remind them of the incident. When you try to talk about it, they either change the subject or say they just need time. You want to help, but you're not sure how to navigate these sensitive conversations. All right, on the poll, the biggest challenge are many, but the building hope thing is always hard, and a third of the people who responded have found that as well. And then knowing what to say is the next most popular option. Popular. All right, over to you.
Okay, here the one of the major goals is to open the door to discussion. Let them know that you're there for them and you're willing and able to talk, but when they are ready. Here again, we're talking about their timeline. We can't force the issue. We have to honor their timeline over ours. When people, for example, have flashbacks and maybe re-experience the trauma, it can be emotionally jarring. And again, make it seem like I better get out the fire extinguisher and put out the fire now. And sometimes what we as partners and family members and loved ones need to do is sit back and let them dictate when they want to talk this out. And if they don't, that's okay right now. Check in with you later, and I'll keep doing this. Eventually, they're going to appreciate that you're not going to abandon them and that you will be there for them. And that will make you an attractive for discourse, for discussion and opening up. But they may test you and you may have to prove that over time of saying, I'm always here, always ready to talk. And you may have to say that 5 or 6 times before they get it straight that, okay, you really are sincere. And then they'll start talking. But there's often a reward with persistence.
As long as it's not nudgy.
That's right. Trying to build hope is another major goal in cases of people who've been through trauma. Reminding them that the wounds of trauma will heal just like physical wounds do. Sometimes we can suffer horrific physical wounds, but the human body, and sometimes I'd say the human mind as well, they are designed to heal themselves, but it takes time. And it's not, no two people are identical. Some people, it can take a very long time. Some might even say a lifetime. Others seem to get over things quickly, but we see so many examples of people who've been through really, really horrific traumas who are doing really well in life. They're successful at their job, their relationships. So there's legitimate reason for hope. This is not just cheap talk. And we need to sometimes remind people of that. Um, there are things you can do to speed up your healing and recovery process. And part of it is talking to others about it, sharing your thoughts, your feelings with other people. If it's not with the loved one, the family member, maybe a professional, a counselor. We have this in the comments about these empaths, other people who've been through the same things you've been through. These are all ways of building hope.
Uh, in the scenario, we had it that the person says that they just need time. And I think what you're saying is that, yes, they do. And
Correct. Now, long term, you got to look at something like PTSD as a long term issue. This is not some time to be searching for the quick fix. So, by assuring them, and I mean repeatedly assuring them that you're there for them, you're willing to talk. If they ever have troubled thoughts or they're bothered by things, they can pick up the phone, they can text, they can visit, they can call you. And I like to say this offer is good for the long haul. It's not just for now, right? I'm not just saying this to you now. I'm going to say it to you tomorrow. I'm going to say it to you next week. I'm going to say it to you next month. until we both understand I am here for you for the long haul. That is such a comforting and reassuring feeling. And when people remind us of that, honestly, I don't think you can remind someone of that too often. The more you can say to someone, I'm here for you. I want to hear what you want to, it's on your mind. The more points you're going to score with them and the more effective that will be. Um, it's also good to check in on their willingness to seek professional help if the symptoms are really disruptive or extremely persistent. That don't miss the opportunity to maybe work that into the conversation from time to time, because there are a lot of traumas where the the need for professional help is quite high, and the person may not even appreciate that. And again, that can be part of that hope building endeavor where you say a lot of people who do get treatment or seek counseling for this end up reporting that it is somewhat helpful. They maybe go to a peer support group, for example, and find others in the same scenario as them. And that can be very reassuring to a lot of people.
Uh, that is true. I think one other thing that is very helpful is to learn about trauma. As a caregiver, it's important for you to understand, you know, you're not going to understand exactly, but you can have a better understanding of what your loved one is going through and be aware of the kinds of situations that may be problematic for them and ways that you can support them. Uh, but it just so happens that Families for Depression Awareness, I wasn't even going to do this, but I realized that we have prepared a fact sheet on trauma that we are happy to share. And I hope you'll get a chance to see that. All right.
One of the greatest therapies in life is spending time with other people. We human beings are social animals. And even if they don't want to talk about their mental well being, that's okay. Being available to spend time, especially doing things that are enjoyable and relaxing to that person. If you know that person well and you know the buttons that could be pushed for their own enjoyment, their own relaxation, sometimes these will improve their mood. And also, by spending time with them, they open the door to conversation sometimes. So, okay, maybe you don't want to talk about your trauma or your experience now. Let's go out and do something. Let's go shopping. Let's go to a ball game. Let's go out to dinner. And maybe in the course of doing that, you may come around to feeling like talking about it a little more. And even if you don't, let's just enjoy time together. That itself is a great therapy. And we talked about that healing process. That is so important to the healing process. Reestablishing, rebuilding social relationships with other people, having positive experiences with them. Positive hobbies, volunteering, sporting events, faith communities, anything that they find rewarding. If you can do it with them and encourage them to engage in those things, that is an essential ingredient in the healing process. And in none of those things will anybody force you to talk about your trauma. So if you don't want to talk about it, that's okay. You can do all those things without having to do that and start seeing the joy of living life.
Um, Michelle has again offered some helpful information that there are several highly effective research-based treatments for PTSD. So that is something that can give hope. There's another question in the comments. Am I enabling him by not pushing him to find a new job? He has PTSD and depression, related to being fired from a previous job. Would working a new job be a way to find happiness? Find a way to happiness. So there's the enabling, there's the
That's a difficult question to ask.
yeah. So
Yes.
enable. Well, can you comment on this idea of enabling? Because people don't want
Enabling,
to
yes,
contributing to the problem, but they also don't want to be not supportive.
that's the key. Enabling happens when we tolerate, if not encourage, if not support or facilitate somebody's engagement in a behavior that really isn't in their best interests. So if you have an able-bodied, sharp, capable person who could be actively involved in the career field, and but who perhaps previously has shown an interest in having a career, and say, "Oh, don't worry, I'll pay the bills. I'll make your dinner and I'll take you to wherever you give you a ride." That could rise to the level of enabling if they are truly able to do it for themselves. And that's like the $64,000 question. In enabling, are you doing something for them that they could and probably should be doing for themselves? And if the answer to that is yes, that may be time to back off. But remember too, trying to push people into things like start a new career is often fraught with difficulties. What you may want to try to do is help build their motivation to start a new career. So let the decision come intrinsically from the person you're trying to influence. Help them visualize. Wouldn't it be great to have a paycheck? You could buy that new car you want, or remind them you are so smart. You have so much to offer. You're such a great accountant. The world would be a better place if you were in the workforce. Here, I'm not trying to push the person to go into a job necessarily, but I'm trying to build their intrinsic motivation for going out and finding a job. And maybe they need to hear that. A lot of people who have PTSD feel like damaged goods, and they need to be reminded that you're not. You still have a lot to offer. Really quickly, somebody commented, what if they never really get out of it? You know what? Part of this is our issue as well as supporters. I want to tell you something. The Liberty Bell in Philadelphia has a giant crack in it, and that's never going to go away. But you know what? It's still a thing of beauty. It's still an American icon that we visualize and respect, and maybe even means more to us because that crack kind of has character, doesn't it? That's how we know it's the Liberty Bell, because we see that big crack in it. So just because someone has been through something really difficult, that they may never fully be the same person again, that does not mean that they're still not a thing of beauty. And we, as supporters, sometimes need to see the beauty in them as a human being, somewhat fractured by this traumatic experience. But that does not mean life is over. Great things can happen to people who've been through really bad things.
I also think that there's something about, I mean, when a treatment isn't working, then maybe you can go to another treatment, but maybe there isn't a treatment. And then you address a different problem, which is how do you live with it? How do you make your life worth living? And there are definitely kinds of support around that.
Absolutely right. Very a form of therapy that's becoming really getting a great deal of attention lately is acceptance therapy. Just say, what we're going to do is not try to change what happened. We can't change that. Let's be realistic. What we can do, though, is learn to accept and learn how to reframe how we think about what happened. Trauma, in particular, is something that we need to recognize it is a part of us, but it does not define us. And this is part of acceptance therapy, is saying, yes, this happened to me. It was terrible, but it does not define who I am. And I am still able to stand up and move forward in life. And a lot of this involves reframing our thought process, because a lot of times going through traumatic experiences, almost the default response to this is that I'm ruined for life now. I'll never be the same again. And in some ways, okay, you won't be the same again, but that doesn't mean you can't be valuable, worthwhile, and productive. And that's the hope part. So the support you can provide will make a difference. Social support from other people is one of the most powerful antidotes to a lot of these problems we're talking about. But this involves understanding, patience, willingness to have tough conversations, to break through difficult moments and help guide people toward their healing. Trust is so important. Never, ever forget, ever. Trust is something you have to give it in order to get it. If you want that person to trust you, you have to show your trust in them and your belief in them. Be careful not to take things personally when you're talking to people who are in a bad state of mind, having trouble, having difficulty coping. They may say things at times that are sort of off the cuff. Don't you have to have a little bit of Teflon coating on your personality at those moments. And also remember your own self-care. We talked tonight about several times about taking time out, take a breather. The more well you are, the more able you are to provide quality care and support to another person. So don't let yourself get ground into pulp. You need to know when it's time to take care of you so that you can be of help to them. And that involves you also asking for help when you need it. There's lots of resources out there in terms of counseling, support groups, forms of therapy, medications, etc. So don't be hesitant to seek help when you find that you need it. There are the Al-Anon is a great example of that. People who are dealing with a loved one with alcoholism and alcohol use disorder, and they are seeking support, help, tips, ideas from other people going through the same thing. Very, very worthwhile. Staying hopeful. Tomorrow is always another day. I don't care on any given day how bad it is, tomorrow is another day. And maintain that perspective. If you think that tomorrow's another day and when the sun rises, it's a blank slate, all kinds of good things can happen. And you start to believe that and live your life believing that, I have news for you. You will be like a ray of sunshine in other people's lives. Eventually, that ray of sunshine will warm them up. It may not happen immediately, but it will happen.
Yeah, hope is just so important. It says thank you for participating to people, but stay with us because we're going to get to the Q&A. Just want to drop in a few things here. If you have to leave now, please do follow up and take our survey. Again, we'll have the uh, gift card for one person um, who answers, and it really does inform what we do because we want to be responsive to you all. Uh, if I missed, I am sure that I missed a lot of stuff in the chat. If there's anything that is a question that you want us to try and get to, could you write it into the Q&A, please? Because it's a lot easier for me to find it there than scrolling through the whole chat. All right. We have I believe, final poll. Um, and we're going to circle back. We'd like to get your responses now to the question that we asked at the top of the webinar. How confident are you about communicating with your loved one about mental health concerns? You can be confident, oh, sorry, very confident, confident, somewhat confident, which I take to mean kind of, or not confident. Um, I did say that, but we'll be putting we already have it. The link is also in the chat for the survey. If you're not able to see that, it's https://www.surveymonkey.com/ADSEP25, which means to us adult depression, September of 2025. Very clever. I've just told you our secret. Um, I would like to, while y'all are doing that, extend a big thank you to our funders. We're able to provide these webinars at no fee to you, thanks to the generosity of people and organizations that believe in our mission and approach. FFDA received financial support for this webinar from Lundbeck, Takeda Pharmaceuticals, and the Massachusetts Department of Public Health Suicide Prevention Program. We're also supported by our corporate members whose support extends beyond specific programs. Tonight, we acknowledge the ongoing support of Takeda Pharmaceuticals, Alkermes, Johnson & Johnson Innovative Medicine, and Neurocrine Biosciences. We're very grateful to the individuals and families who donate to FFDA. If you'd like to make a donation to support our mission, please head to our website at familyaware.org/donate. All right, on the poll, I think people moved up. What do you think? I think there are fewer not confidence than there were, and there are more very confidence. And I think that people shifted. So I'm feeling good about that. Oh, I am so happy to see somebody. Um, so we have some questions from people, and I think I am allowed to, well, stop sharing for now. All right, so maybe that's us. All right, you ready? We spoke about some specific scenarios, but here's a more general question. How much listening is acceptable when someone is just saying negative things about their life? How do you respond to self-criticism? And I think that, how much listening is acceptable, you know, I think how much listening can reasonably be expected is probably the way to go for it.
One thing that I often consider is the extent to which new ground is being broken in the conversation. If we're rehashing the same thing over and over and over, and you're convinced we're not moving forward, we're not getting anywhere, and maybe even that the person I'm communicating with is getting worse by just regenerating, the rinse and repeat cycle. That's a judgment call we have to make, where we may want to just sort of take a time out, have a breather. Let's come back to this tomorrow. And maybe even say to them, Frank, I feel like we've been over all this already, and it doesn't seem like we're getting anywhere. It's just making you more angry. Why don't we take a time out from this? That's when I think it makes a lot of sense to just tap the brake pedal momentarily. There are a few topics that have to really be resolved now.
There are a few topics that are solved by saying the same thing over and over.
That's true as well. That's even more true.
I know, and it's hard because you don't want to be dismissive of them,
Right.
you know, but I think we go back to some of the other things of, proposing alternatives or encouraging treatment or, you know, any one of a number of those things. Um, all right, so many of us know that not maintaining personal hygiene or wearing the same clothes over and over is common with depression. Not showering or bathing. Uh, the person says they can't do it, they don't feel like it. How can you address hygiene concerns?
Very tough, very tough. Because usually when they're willing to let that go, they're not going to be very open to outside suggestion. One possibility might be to try to find something that they would agree to do for which the correction of hygiene would be instrumental. For example, hey, Susan, I see it's your birthday next week, isn't it? How about if we go out to a really fancy restaurant and have a nice dinner? I'll take you out, I'll buy that kind of thing. What I'm doing here, I'm being a little clever. I'm trying to get you to think, well, if I go to the fancy restaurant, I probably do need to clean myself up a little bit and put on a nice outfit, that kind of thing, rather than just saying, shower and change into your good clothes just for the sake of doing it. If I can attach it to something like going out to an event of some sort, a movie or whatnot, for which you would naturally come to the conclusion, yeah, I probably can't go looking like this. That might be one way to do it. Sometimes also just reminding people how, a nice hot shower and a change of clothes, especially clothes that you like to wear, don't underestimate what that can do to the mind. That can change your outlook on the whole day sometimes. So why not give it a try? Sometimes people need that extra bit of encouragement.
I think that all makes sense. Um, and just to go back to the self-medicating thing, it's the behavior, not the person.
That's right. It's the behavior. That's right.
Um, I think this is kind of a HIPAA question. How to contact the loved one's doctor with important information if the doctor isn't authorized to talk with you. I actually have thoughts if you don't.
Well, I mean, many people in receiving some kind of care have somebody who has medical power of attorney. If that's you, then you actually can have that conversation. If it's not you, my next question would be, do you know who that is? Because that would be one conduit to the physician or the care provider. You may not. And if that's the case, one can reach out to a care provider, but that's going to be a one-way for professional reasons, it's going to be a one-way line of communication. You can make a phone call, you can send a text, you can send an email message, but they're not going to be disclosed to talk to you if you are not a certified um, person who has medical power of attorney. Through that third party, find out who is the individual who's got the medical power of attorney and see if you can have them do some shuttle diplomacy and deliver the message for you if possible.
Yeah, I mean, I also think that the way that they phrased the question was contact with important info. And so to me, that indicates kind of an understanding that it's not going to be a conversation. But if you have information about previous experiences or previous medications or behaviors that they're doing now that are of concern, any of those things that are not conveyed by the person themselves, the healthcare provider wants to know, you know, that when they're making recommendations for treatment, they need to know what's going on, and no healthcare provider wants someone with depression to waste their time doing something that they've done before. Um, I think there's a bit more compassion than that. Maybe the
My
insurance
spouse was
company.
diagnosed with bipolar and they stopped taking their medication. There's a message you could shoot off to the
Right,
caregiver. Yeah.
absolutely. I think this is a variation on the emotional crisis scenario. What suggestions would you make about how to handle a situation when a loved one is lashing out? Is it best to stay silent? How to help calm them down?
Silence can be useful here. Sometimes letting them know that I know you don't really mean that, especially if you sincerely feel that way. You know, it's like in with AA, they'll say that that's the alcohol talking. That's not you. Yeah, this is the focus on the behavior, not the person. I know that's not you. I know you don't feel that way. Or uh, despite that, you're having a bad day today. I'm still here for you. I still want to be in a relationship with you. You're still part of my life. I still value you. And let them lash out for the time being. This, again, not a time to counteract, not a time to get defensive, not a time to make it about you. This takes, friends, this takes extraordinary emotional fitness to put up with that, the berating from another human being who's just dressing you down. But remember, focus on the behavior, not the person. This is the depression talking. This is the anxiety talking. This is the manic phase talking. That's not the person who you know and love. And sometimes just let them know that.
So I'm thinking, if somebody is yelling or having outbursts, this is a question. The way I first read it, to me, there's a difference between somebody yelling at someone versus someone um, who their natural reaction is expletive, and then they can go on with their life, whatever it is.
Yeah.
um, uh, and we know that people are stressed and all of that, but is it fair to say to someone something about their yelling or outbursts?
Yeah, essentially, I think if we're going to be like, let's say we're talking about a spouse, for example, and you got a long-term future with this person. Certainly, we eventually want to shape this relationship into something we can both live with. And there's nothing wrong with saying, when you talk like that, it really kind of gets under my skin, or it worries me, or it scares me, or it hurts me to hear you say that. There's nothing wrong with being honest with people about that. Again, we don't want to sort of bludgeon them with this, like I'm judging you, but it is okay. Someone before said it's in the chat said this is exhausting, and it's okay to say, I feel exhausted having to kind of go through these outbursts over and over again. But the key is what I want to do is find out what can we do to get you to a place where you don't feel this way, because I would love to spend quality time with you where we're not in a state of distress, and let's talk. And what would make you feel happy? Again, remember the questions so you get yourself into the listening mode. Ask questions and then stop and listen. That's a great way to turn down the temperature, let them talk it out, and maybe they're going to raise their voice for a little bit, but a lot of times they'll gradually bring it down if they sense that you're not judging them and you're listening to them and being attentive to what they're saying.
That's really helpful. Someone has raised the situation that a person has been uh, unsuccessful with treatment for a long time, um, but they are having trouble having the conversation because within 3 to 5 minutes of starting the conversation, then the person is crying. And I know that some of this is hope issues. Um, and I mean, if I were in that situation, I mean, I would definitely be thinking there's something wrong with me, that all of these treatments that work on other people are not helping me. So obviously it's me.
This is a difficult one. When people are crying, they're usually flooded with affect. And that's not a good time to have a rational conversation because we're not, when we're flooded with affect, we're not at our highest in terms of cognitive processing. We all know that. So sometimes when people are in that high state of emotion, the thing to do is to let them kind of work that out. Let that kind of, I hate to use the analogy flow because we're talking about tears, but that's it. Let that emotion sort of flow out of their system and through their system to the point where it gets settled down enough that they're now able to have a conversation and start talking. When people are sobbing uncontrollably, usually they can't literally form words and talk anyway. So just give them the time, non-judgmentally, give them the space, let them and give them the assurance whenever you're ready to talk, I'm happy to talk with you right now. I can see why you feel this way. I'm here for you if you want to give them a hug. Someone commented earlier about the importance of nonverbal behavior, a touch, a hug, eye contact, just reassurance, and then let that naturally subside. If it's anger or violence, that's a little bit different because those are much more threatening. But if it's extreme, profound sadness, sometimes the best thing we can do is just be a bystander and let no, I'm here. I'm supportive. Even if it means I'm going in the other room, I'll be in the other room. I want you to know. The key is I'm here for you and I'm not going anywhere.
And I think we can probably also go back to, your reference to the acceptance therapy, that that, you know, if this is your situation, then how is it that you can get through it in the best way possible? Like, the the best case in a worse situation.
Very often that's what we need to be in the at least in the immediate is think about how can I accept the fact that this is my lot in life at the moment and still find ways to be happy and productive. But very often if you're motivated, you can find those ways.
Um, we always expect that at some point there will be a change in the behavior. And I actually should refer people to our series on our website about the stages of change. It's also on YouTube, and that can help people have some perspective on, you know, uh, people not engaging in conversation, but also what if they never decide to talk about it with anyone or get any type of help?
This is a very difficult one. It's a personal decision you need to make about when is this relationship dragging you down to the point where it's basically ruining your life now. And I'm sorry to say there are people who get to that point where they make that decision that I need to exit this relationship, and that's a very, very personal decision that is made, I think, often with years of experience and knowledge and estimation of the fact, like you said, this is never going to improve. Um, it's sad because it sort of suggests to me that hope has been lost, that they just this relationship's hopeless. I cannot maintain this. And we find sometimes that people, when they persist and hang in there, a lot of times things will improve. Now, sometimes that we're talking about a decade. And I know some people, they say, I don't have a decade to offer this relationship in this state. I get that. Quick anecdote. In the 1970s, there was a recording act called Captain and Tennille. I don't know if any of you know the story of the Captain and Tennille.
Love will keep us together.
Love will keep us together. How ironic. The captain he was somewhere on the autism spectrum, and Tony Tennille wrote a book about their marriage, and it was not much of a marriage. And she stayed with that man for something like 35 years. They finally got divorced a few years before he died, but for something like 35 or 40 even years, she said, I just believed he'd get better, and believed and wanted him to get better. And she said, it never came to fruition, but what strength and persistence that woman demonstrated. And, you know, they had a great professional relationship. And she talked about how he was such a great composer and songwriter that she said, I don't have any regrets being married to him because he literally, made both of us successful. But what a extraordinary price that poor woman paid. Just never really, because of his condition, he never was able to really connect with her on a sort of romantic level. It's so sad story. And she made the decision very, very late in his life and hers, said, I got to get out of this relationship. It's just too toxic on me. That's a tough one, but you do see cases of that with people. But for every one of those, there's other ones where, you know what, it got better. I stuck it out and it eventually got better.
And it's really hard when it's your parent or your sibling or your child. Uh,
Yes,
and yeah, I think that there are sometimes really awful decisions that have to be made. Um, but I think that there may also be degrees of involvement, like not being quite so invested, but still being available. Uh, anyway, I'm just thinking aloud.
that's
And
right. Release the accelerator pedal a little bit, but keep going.
yeah, and now curse is on you that I have muskrat love in my head. And for anyone who's my age, sorry about that. Um, all right. Let me take a quick look. I don't know what this question means, and if you don't, then we won't do it. But when do you end the perseveration cycle when you are with someone that wants to get a point across?
Oh, do you mean like um, persevering and recycling the
I think
same
so.
point over and over?
I think so.
Sometimes people just need to be reminded that they are repeating themselves. We've already talked about this. And again, if you do it non-judgmentally, let them know, I hear you, I heard you, I understood you when you said that. You don't need to go through it again. Maybe like reminding them, it seems like you're getting more agitated the more you keep saying this. So help them to understand that you kind of like, I got it the first time in a polite way, can help some people if they don't realize. A lot of times people think about it, put yourself in their shoes. People start repeating themselves in conversation when they feel that they're not being understood. So one of the greatest ways to get people to stop repeating themselves is do what you can to convince them that you actually do understand them. You do care what they're saying and you are listening to them and you did hear them.
Someone asked about um, that their friend likes silence and likes to think about death. How can they help? And I think this probably goes back to just making it known that you're available and willing.
That's right. You're available and willing. And also you have a desire. I desire to have you in my life. We've all heard the saying, it is a permanent solution to a temporary problem when someone's contemplating suicide. And my addition to that is the world is going to be such a better place with you in it. You may not believe that right now, but you don't know what tomorrow holds. You may go on and you will go on and do great things. You're going to touch people in ways that are going to make them better people. And this world is a better place with you in it. Some people need to hear that. How many people actually have ever heard someone say that to them? That's not a message we share very often. But sometimes we need to pause for a moment and just tell people, you know what? I feel this world is a better place with you in it, even though you're suffering right now, because I believe that you have a lot to offer. And that would be a shame if that was to come to an end sooner than later, by regardless of how that should happen. Your life is precious, and I feel that way. And I want you to be around with us because I want to see how this show ends. And we still got a long way to go.
Um, and people should know that there are people who experience what's called suicidal ideation, where they think about death, they think about taking their own life, but they don't have the intention to do it. And I mean, I would suggest that there may be some therapy that could help with that, but I think that that's just a fact of life for some people. That's something that is, often in the back or front of their mind. They're not going to do anything about it, but the thought exists.
And those thoughts can be politely and non-judgmentally challenged. That's right. Say, and maybe even normalized. Lots of people think about that from time to time. That doesn't mean you're going crazy or anything like that. But you know what? Remember, you have a lot to offer. And so please stick around. I want to see what tomorrow holds for all of us.
Um, Tell me if this is the same thing as self-medicating. How do you help build intrinsic motivation when the person engages in escapist activities like sleeping a lot or staying up all night, spending the whole day reading, scrolling Instagram, etc.?
Your connection to self-medication, I think, is spot on. These are all forms of mood management. And sometimes we have to give people a little latitude to do what works for them. So, I mean, ask yourself sometimes as the caregiver, the loved one, the supporter, whatever term you want to use, what's the alternative? If I say, hey, turn off that smartphone, you've been spending too much time, looking at whatever. If that's bringing them some happiness and joy, sometimes what we need to do is sort of change our tolerance level and go, you know what, just give them their space today. When it's getting to be almost like a gambling addiction or something like that, where it's getting out of control, and it's starting. And there are internet addiction diagnoses in DSM. So when you start seeing it like keeping them from going to work, or they're spending all their money on, whatever, internet gaming or something like that, that's when it's time to really kind of drill down. But if this is a kind of thing that they do on occasion, you find it annoying and obnoxious, and by the way, so do I would as well. That's totally normal to go, why was it? But maybe if this is getting them over some hump, give them some time and space and see how it goes. If it becomes habitual and it's really detracting from their quality of life, and importantly, their responsibilities, if they're not meeting their responsibilities because they're spending time online, let's say, that's when okay, this is a problem that really needs to be addressed, discussed, and by the way, maybe even referred for professional help. Because if they're repeatedly going back to the same thing and persisting in it despite negative consequences, that's when there's a real problem that needs to be addressed.
Yeah, procrastination doesn't pay either. Um, uh, Someone asked if a family member is escalated and disrespectful, is it unreasonable to ask them to leave until the time comes when calm discussion is possible?
Yes, I think it's reasonable. You want to do so with the knowledge that they understand you, they can respect that, and that if you say, like, I'd like to talk about this tomorrow, they actually will pick it up. We talked earlier about people who are maybe on the verge of self-harm. We said that those are times when you don't want to leave people alone. So you have to use careful judgment here. And if you can be confident that they'll respect you for saying, hey, you know what? Okay, let's take the night off and then we'll talk tomorrow morning when we go to work or something like that. And you know that you can pick it back up. That's reasonable. Don't be ashamed to stand up for yourself and go, I need a break from this just for a moment. And again, that doesn't mean there's anything wrong with you and what you're doing. It's just I'm getting exhausted and I need to get some dinner, get some food in me, something like that. That's okay. Let them know why, though, and make sure they understand this is not about me being mad at you or angry at you or judging you.
Yeah, I mean, I think you spoke about caregiver self-care, and part of that is establishing boundaries, which means how far will you allow behaviors to happen, and when do you say no? So we have a little webinar on boundaries too. But
So important in those relationships.
yeah, and it is part of self-care. I mean, it needs to be. And I think just with that, it goes to what you were saying about being clear, so that people can have a set of expectations, and they may not like your boundary, but you're allowed to enforce.
Right.
All right. There were a couple of questions that are more about treatment, and so I, we're not going to do those, and I apologize. It's just not part of what this webinar is equipped to deal with. I do, encourage people to, we might have a blog on some of these things on our website or an expert interview. Um, uh, I would say though that uh, when a, a person contacts a healthcare provider, often that healthcare provider will at least tell their patient that they spoke with you. It's not always, but I think it's probably more often than not, because to them, preserving the trust of the relationship is more important than whatever you and this person have going on. All right. Um, I will again look around for how to do what I'm supposed to do here. Okay, I think that this is working. Uh, Dr. Segrin, thank you so much. Uh, this has been so much information, and true to form. It really focused on practical ways to manage situations. Uh, really actionable advice is what we refer to it as. And this is what we really try to do with our webinars is have people leave with some strategies that maybe they didn't have, or some new confidence to try out something. So thank you so much for doing that. Really appreciate you sharing your time and expertise to benefit our audience of family caregivers.
Thank you for having me.
Oh, it's my pleasure. So y'all, please complete our program survey. We'll put you into the drawing for a Amazon gift certificate. Our next webinar is in collaboration with the National Eating Disorders Association. We'll discuss the relationship between depression and eating disorders in teens. I hope you'll attend. That's Wednesday, October 22nd at 7 o'clock Eastern Time. Or you can watch the recorded version afterward, but we're excited about this collaboration, and it's a topic that we have not really addressed previously. So yay for that. Sign up for our newsletter. Join us on social media. We are at Family Aware on Facebook and Instagram. We're at FFDA1 on YouTube, and on LinkedIn, we are Families for Depression Awareness. Big surprise. Visit our website. We got lots of stuff there. And, reach out to us at info@familyaware.org if you have questions that aren't answered on the website. We are gonna end it now, and thank you all so much for spending this time with us. We are very grateful for you, and hope that you are leaving with some new tools in your kit. Thank you very much.